The following audio-supported podcast is intended for informational and educational purposes only and is not intended as medical advice. Please speak with your healthcare professional before making any treatment decisions. The guests on today's show were paid to participate in this podcast.
What's up, Cheat Codes listeners? It's me, Dr. Z. We've got an exciting episode for you today. You're about to listen in to a lunch and learn session sponsored by the Agios Diversity Council that I had the opportunity to moderate recently. My guest is someone you know well. My guest is Dr. Simone, and she shares her inspiring journey living with and advocating for sickle cell disease. She discusses her background, her achievements in medicine and advocacy, and of course some personal experiences with misdiagnosis and challenges that are faced by sickle cell patients. I really hope you enjoy this one. I know I did.
Agios is a biopharmaceutical company that's fueled by connections with patient communities, healthcare professionals, patients, and each other. Building on these connections and the company's unmatched leadership in the field of cellular metabolism, Agios is pioneering therapies of genetically defined diseases, a broad group of rare and more common diseases that are typically severe and life-threatening. Near term, Agios is focusing on hemolytic and acquired anemias, including sickle cell disease, pyruvate kinase or PK deficiency, and thalassemia. To learn more, visit agios.com. That's agios.com.
Welcome, everybody, to today's Lunch and Learn on health disparities in sickle cell disease. I'm so happy to be here today for a variety of reasons. The first is that this Lunch and Learn is sponsored by the Diversity Council. The Diversity Council is a wonderful initiative here at Agios. But the real reason I'm excited for today is because I get to spend time with a colleague who I admire tremendously. Today, we're joined by Dr. Simone Uwan. And Dr. Uwan, first of all, there's no way I can do justice to your introduction, but I'm going to try. Dr. Uwan is an accomplished physician, author, and sickle cell advocate who specializes not only in medicine, but in public health and medical advocacy. Primarily, her work is in sickle cell disease. She's been active in her public service since maybe now 20 years or so, and has taken on various roles. Most recently, she co-founded the Sickle Cell Medical Advocacy Organization and has been working on generating content for patients, caregivers, and raising awareness. She's a prominent social media figure, running a YouTube channel and empowerment group that educates and inspires the sickle cell community. Notably, she has major publications in the space, in fact, 2 publications that are #1 best-selling books, and several other works that have appeared not only in journals but magazines as well. In the clinical realm, she is a family physician that has worked exhaustively in a variety of roles, catering to diverse populations, including geriatric, reproductive age women, those with hemoglobinopathies. She started her academic career at the Columbia University, where she majored in biology, and then got her medical degree at Stanford University School of Medicine. Dr. Uwan has a multifaceted career and has had a strong commitment to advancing medical knowledge, patient advocacy, particularly in the field of sickle cell disease. And all that being said, she's a sickle cell warrior herself. Dr. Uwan, welcome to Agios' Lunch and Learn.
Thank you. Thank you so much. You always make me look good. So I thank you especially. But it's good to be here today and share this time with you guys.
I've gone over your CV a few times, and I am just blown away every time by how much you accomplished. And one of the things that struck me in your bio was that your diagnosis with sickle cell disease didn't follow a typical pattern.
And I am finding that's not uncommon. I was born and raised in Guyana, South America, and the medical technology was really lagging there, right? Whenever I would present with symptoms of a crisis, which I now know to be a crisis, we, first of all, didn't go to the doctor until you were half past dead. So we never thought to take me to a doctor. I loved school, and so I would push through many days to go to school. And when I couldn't, my mom, who was a single mom, would just rub me down with something. There was always an herb in the backyard that she could pick or make me drink, and
That's
the
funny.
fevers would go away. I now know lemongrass can reduce fever because that's
Wow.
what I drank my childhood, and that's what we did. And it wasn't until I was 12 years old that I had my first life and death situation where I coded and the whole nine and was in the hospital for a month. I now, looking back, know that to be my first acute chest syndrome. And because it wasn't handled as acute chest syndrome, I sit here today with portable oxygen because you have to know what you're treating in order to treat it well, right? By the time I got diagnosed, I was 19 years old. I was about to be a junior at Columbia University, and I went on a plane trip to Canada, came back, felt like my lungs were falling out, and a few hours later was in the emergency room. And before you knew it, it was lights out. And I woke up 8 days later. I was on a ventilator. I had been fighting for my life. When I say these things, it almost sounds like another person, but that is how I found out that I had sickle cell disease, because they did every imaginable test, wanting to know what got me to such a crazy crash point. And then looked at my mom and said, how could you not have known this? She didn't know it because we grew up outside of the United States. In the United States, you're tested in all 50 states as of 1990 or so. So people are tested, but outside of the United States, that's not the case. So if you come in after you're born, and think about it, we don't have other age points that we retest or we bring people in again. Like, say, okay, first grade, or you're going to high school, you should check again, or you're off to college, you should check again. They're not these screening points. It's just
Right.
birth and then nothing. And so I wasn't tested, and that's when I was diagnosed.
I want to dive in, double click on that a little bit. Usually, for me, when we would give news of a newborn screen being positive, sickle cell disease being there, of course, at that point, the child has no idea what's happening. It takes many years for that to happen. But getting the diagnosis as an adult who had the background in science and medicine, what was that like?
Okay, so I was pre-med for very different reasons, but I was pre-med at the time. So I fully understood what they were telling me, but I will say there was good and bad to being told late. And what I've seen with my age mates is that when you're told as a child that you're going to die by the age of 20 or 30 or whatever it is, whatever pronouncement that they make over you. At 19, they said I was going to die at 20. So it does something to you, though, right? If you hear that at a young age, you start thinking, why dream? Why fight? Why fight for my big, beautiful life? But if you hear that at 19, you already started living that big, beautiful life. And you're like, I'm not going. Like, for me, I just thought, I am not going out like this. Do not go gentle into that good night. I am not going out like this. So I think I had more of a fighting spirit, because by then, yes, I had lived in pain. Yes, I didn't know what was happening to me, and I would pass out at school and be writhing in pain and all of those things. Yes. But at the same time, it didn't have a name. And because it didn't have a name, it didn't have a pronouncement of life or death over me. And as a result, when it did come, I was old enough to say, no, I reject this notion that I'm going to die at age 20. I'm going to live. I'm going to fight. And so I think I have just overall more of a fight in me because of that.
That's so powerful. This notion of it didn't have a name, right? It was causing destruction, problems, but it didn't have a name. So you get the name, you get the label of these symptoms. What else came with that label or that name that you didn't anticipate?
Depression. I used to tell people for about 5 years after, I had to wrap around my head what was happening to me. I didn't believe you could feel that much pain in your body and still be alive. And what happened was because I went through, it's a time sensitive tissue injury when you're having a vaso-occlusive crisis, right? So you have to act quickly, but they didn't know to act quickly. So by the time I woke up from that coma, I had muscle damage. I had to learn to walk again. It took months for me to walk by myself. I had to take a year off from school because I couldn't walk. I started a blood exchange transfusion because they said there were so many organs that were damaged or compromised in some way that another sickle cell crisis could tip me over the edge. So for a year, I had the exchange transfusion to make sure that nothing happened. And so that became my life. And I was like, the whole time I just kept thinking, what is going on? I know that they're telling me I'm going to die. That ain't happening. But in the meantime, what is going on? And so I think, to be honest, depression came with it because I watched myself become limited. I watched my physical abilities become limited. I watched my lungs not work right. And I kept hearing these pronouncements that I didn't like. So it took some adjustment. I will tell you that. It took some adjustment. But I think that there was a part of me that thought, if this is going to happen to me, let it happen with me living my best life. And I think when you meet people living with sickle cell disease, you will find that, like, a lot of people, despite this amazingly painful, life-threatening thing that's happening, they're deciding, I still want to live. I still want to have a big, beautiful life. It might not be beauty like you think of beauty, but it's my beauty and it's okay. I want it. And so I think that was the river I had to cross at that time, to journey from this is what's happening and this is my new body, to a self-acceptance while I'm still dreaming about my life, dreaming of what I'm going to do, what I'm going to be. Yeah.
It's beautiful. And it's giving me chills just hearing the story in your words. You got to the bank of the river, and not only did you cross it, you crossed it and you've built something amazing on this journey. The starting point of this diagnosis journey happens to you, sounds like, in college.
Yes.
And you at some point say, you know what? This isn't going to stop me. I'm going forward. And you end up at Stanford.
I know. Listen, when I tell the story, I feel like I'm speaking about a different person, but it is me. I woke up every day in pain, learning how to manage my pain, learning to go on pain medications that were so sedating. I didn't want to be on them. I'm telling you, that's why I'm so ticked off when I hear of patients going to the emergency room, and or even me, before I became a doctor. I mean, after that I could fend for myself, but before that, people thinking anything less of me. It's like, are you kidding me? I don't have time to be here. I don't want to be here. I'm losing tickets to a concert that I paid a whole lot of money for because I'm here. And I'm missing all kinds of life because I'm here. I don't want to be here. But yeah, learning to live with medications that you're trying to decide if you want to be out of pain or lucid, because you have to choose. You're out of pain, but you're sedated. You're in pain, but you're lucid. And you're constantly having to choose as you're going through a pretty rigorous curriculum at Columbia University for pre-med and studying for the MCATs and all that goes with trying to get into medical school. But I had along the way, and this was a couple of years after I was diagnosed, I met another friend. She was actually at NYU at the time, and she had sickle cell disease. And we promised each other we're going to find the cure for sickle cell disease. We were going to adopt children of every culture just because we could, and because we didn't want to have children with sickle cell, and life was going to be great. One winter, it was very cold, and we both ended up in the hospital. I made it out, and she didn't. And I had to let my friend go. But I promised her, she was holding on for a while, even though her organs were crashing, and her family thought she wanted to speak with me. So I went to her bedside and I told her, no matter, I know it's tiring. So if you can't do this, you can let go and I will do it for the two of us. I couldn't afford to give up because I also made a promise to my friend who was pre-med, who was going to be a doctor, that I would do it and I would do it for the two of us. That's what I did. That's what I did.
That is an incredible story, and I firmly believe that your friend is looking down and smiling on what you've built, what you've done, what you've accomplished. Certainly enough for two. Certainly enough for two you've accomplished, and probably even more. Thank you for holding it out, and thank you for supporting your friend, and thank you for honoring her in the way that you have. That's just an incredible story. I'm speechless, and that never happens to me. But Dr. Yuan, I want to ask you, as you alluded to this, the stress of building your career, the stress you carry of holding a label that has put an expiry date on you of some sort, that they've told you 20 years, 30 years. You go through this really rigorous training and deal with these very stressful situations. You obviously undertake a deep learning and understanding of what's happening in your own body. Did being a patient with sickle cell disease make you a better physician? Tell us about that.
Without a doubt. I walked into every room not as a doctor or thinking like my colleagues. And I realized how different I was because cried with every patient to the point that my attending said, you have to put a healthy barrier between you and the patient. And I couldn't find that barrier because I was a patient myself. And when I sat with my patients, I didn't sit with them as an authority and they my subject. I sat with them as another person journeying through with something that might be bigger than them. And I didn't have a choice because they could see my disability with my oxygen around my nose. And I think there was something about that that made them feel comfortable because they understood that I knew what it felt like to be a patient. And so I felt like they brought their barriers down too. Oftentimes they spoke to me in a way that felt like they were just talking to another person and they divulged things. They would say, oh, I didn't tell the other doctor this, but what do you think about this? Because I was just desperate and I was just trying this, or I just got really frustrated with just being on medicine all the time. So I went out with my friends and I just stopped taking my medication. I just wanted to be normal for a day. And I could relate. Instead of flagellating them, I say, I get it, but we're going to have to pick it up and put it back on because we're fighting for you. I could speak on the level of another person struggling with the same things, and it brought us together. All my evaluations, and I'm not kidding you, were just amazing. Every year, even if I might have had a colleague that thought, you know what, you're getting sick too often, or, I was always saved by my patient evaluations because they were always amazing. And I believe it's because of the fact that we could bond on that level, that they understood that I understood pain.
It's beautiful to have that common thread, I think, especially in allowing patients to find places of comfort and places where they can be themselves, they can be honest. Because sickle cell patients, obviously, and you and I have talked about this, the hospital is not the hospital, quite frankly, is a hostile place for sickle cell disease patients. So I'm sure they found tremendous comfort in somebody who empathized with them and felt exactly what they've felt. To that point, I want to dive in a little bit on your journey into becoming a patient advocate, a medical advocate. I'm sure along the way, there were critical points in your journey where you said, you know what, this is it. This is what I need to do. This is the nexus point. This is what's going to push me into advocacy. What were those sort of events that made you realize this is what is necessary?
May I share something? I picked a couple of things from my book, and I think this might be an appropriate time to
I
share
love it.
in
Absolutely.
answer to your question. And I didn't know you were going to ask me that question because you didn't give me any of your questions you were going to ask me. But it
Well, like I
seems
told you,
to,
this is just me and you talking and getting to know one another.
I'm totally fine with that. This is from my book, All Rise, The Sickle Cell Community versus the Medical Establishment. It's chapter 11. It says, "Why don't you believe me? Have we met before? I could have sworn by the way you were looking at me, by the way your smile never reaches your eyes, that you had met me before and I had done you wrong. You would think I knew the rules of the game, but I was somehow still violating them just to make you lose your cool. Something is very wrong with the way you're speaking to me, as though you caught me with my hand in your cookie jar and you had videotaped evidence to prove me a thief. As you say to me, you're not in a sickle cell crisis. Your crit is normal. The nonverbal communication between your colleagues is not missed either. There seems to be an unspoken consensus that I am not to be believed. You agree that my blood pressure is unusually high, completely normalizing with a dose of Dilaudid. And you agree that my electrophoresis results, which I brought with me, corroborated my story of sickle cell disease. It prepared you, explaining that sometimes I have normal hemoglobin levels during my crises. I told you of my lung infarcts only showing up on imaging 2 weeks after the incident, only when healing had started and calcification now highlighted its margins. Yet you still have chosen to render medical treatment to your textbook. I don't know how to tell you this, but your textbooks are inaccurate. Oh, they have what you know so far, but surprisingly, that's very little. I know what's going wrong, but you won't listen to me. You're nervous to admit my pain because this obligates you to do something about it. And how can you when the medicines you have, those medicines others overdose on, I drink like water through my veins and still cry out in 10 out of 10 pain. They forgot to include that there are dozens of hemoglobinopathies that have become complicated once saddled with just one gene. I'm going to jump. You say your crit is normal and force me out as though I ever wanted to be with you. I'm missing the concert with tickets that cost me a small fortune. Yes, there may be less anemia, but my extra abnormal cells that make my hematocrit look normal have now put me at risk of a stroke or a pulmonary embolus or maybe a vascular necrosis, but all with certain end organ damage. Turns out those invisible acute onset pain signals still mean danger, even as you look only for signs but ignore my symptoms and send me home untreated, or perhaps not treated at all. I hope I don't become ineligible for a stem cell transplant or a promising clinical trial. I pray I'm not too sick for the pound of cure because you held back an ounce of prevention each time I presented with only symptoms to explain my internal torture.
Wow, that is an incredible passage. Thank you for sharing that.
You're welcome. That's one of the reasons I had to go into advocacy because I experienced that look when it's an interesting thing when I don't know if you were ever a child where something happened and you went to an adult and you said, something is happening to me, and you entrust this something that is painful, that's bigger than you, you're little, you can't handle it. And then that adult, that authority turns around and tells you you're lying. And then who do you turn to after that? There's a learned helplessness that happens because you went to the top people. You went to the people who could fix it, and they're telling you you're lying. So there was something very painful, hurtful about that. I felt as though I was having surgery without anesthesia. Everyone is allowed to have anesthesia. Why? Because if you cut someone open and they hurt as badly as that, their blood pressure could shoot up, their stress, the amount of stress hormones that would shoot through their body would be so immense that it could stop their heart, right? And yet each time that you have a sickle cell crisis, that's what it feels like. It feels like you're about to have surgery with no anesthesia. So you run to the place that could give you anesthesia, and they say, you're lying. You don't need anesthesia. You have to go through that surgery without anesthesia. And so you have an array of responses. You get people who start screaming and crying and insisting that I need that anesthesia right now. And then what's perceived is, oh, they're drug seeking. They're so fixated on that drug. Yeah, I need anesthesia. That's why I had to go into advocacy.
Wow. Everything you're saying just resonates so deeply, and it's what we hear over and over again. Yesterday you said something to me that struck me in our conversation when we were preparing for this, which was who you pass on the way to the hospital. Remember you told me
Oh, yeah.
that
Yes.
I thought was I would love for you to share that anecdote.
Actually, I have it on my TikTok because sometimes I sit and I think of these things that just irk me, and then I decide I'm going to make a video about this or I'm going to make something about this. But yes, we're in pain, but we don't just want pain management. We want medical management. So we gather ourselves and we bypass all the drug dealers in the neighborhood that could give us tea of medicine for a very little bit of money. Certainly less than it's going to cost me at the hospital. And trust me, it's costing me something at the hospital, whether it's time that I'm away and need to be in certain places, whether it's the money that the bill that they send on top of my insurance that I can't afford to pay because it keeps coming with rapid fire that I'm afraid that is going to ruin my credit, right? Whatever it is, I still bypass all those drug dealers in the neighborhood and I come and I place myself before a medical doctor. Why? Because I want to do it right. I don't want to take matters into my own hands. I don't know what's happening. And I don't know what's happening inside my body. And there are a lot of things happening inside my body, right? That pain is an indication that things are going wrong. So I want you to help me through it, not just with the pain, but with what is causing the pain, right? And if I just wanted drugs, I could get it for cheap, but I don't. I want medical management, right? I come and I get 1 milligram of Dilaudid and I sit there going, this is not working. This is really not working. But I sit there.
Yeah, no, it's incredibly powerful to hear that because we really put patients into a position of desperation often with the way that we treat them in the medical establishment. Now, speaking of the medical establishment, I want to dive into the 2 books that you've written. The first is All Rise.
No, the first is A Doctor in a Patient's Body. It's memoir meets survival guide.
Yeah.
So this is it right here.
Well, the subtitle is what I love the most there. A Doctor in a Patient's Body, Dreaming Big
So it's A
with
Doctor
Sickle
in a
Cell
Patient's Body, Dreaming Big with Sickle Cell Disease and Chronic Pain. And that's because I still believed I had a big, beautiful life that I wanted to live. And I am living it. I was talking to my husband last night and I said, we're talking about spiritual things, but we're talking about the book of Job, really, and all the suffering that this guy goes through. But then afterwards, he has a life and he lives 140 years. And after all of this, and I said, I think I'm living my post-Job years. I feel life has been hard. I've gone through so many 5 hip surgeries, you name it, living without my hip for a whole summer. But here I am, and I'm able to help other sickle cell patients. And that gives me so much joy for no money, by the way, but for some reason that gives me more joy than when I was clinically practicing. I run a nonprofit organization. I love doing that. I love being able to empower sickle cell patients, teach them what they need to do, what they need to say, how they need to say it, what information they need to know that maybe even their doctor doesn't know that will help them, what IV fluid they need that will help them, that they need a hypotonic saline solution and not what everyone else gets, because that's going to put them in trouble. But if they ask for this, it's going to help them get out of a crisis. Something as simple as that, to be able to pass that along brings me just unspeakable joy. And I feel like I am living my best life now. And people will look at me and beg to differ, right? Because I have to still manage my health and I still walk around with oxygen in my nose and I still can't walk far and I still have to use a wheelchair if I'm going more than a block. And so they look at that, but I look at impact.
I firmly believe that we can't measure impact based on the number of steps you've taken. Your impact surpasses the physical realm, certainly, and you've empowered patients globally. You've educated medical providers globally. Your impact is unmeasurable by all means. I want to also take a little bit of time to talk about non-sickle cell things. You have a lot of hobbies and interests. Tell us about those.
I like to write. I've always liked to write. So I write poetry, but I also love writing. So I'm 52. Yes. And by the way, I will tell anybody my age. Women say, oh, no, I will tell you my age because I have earned every day of this. I'm going to be 53 November 12th. And I was challenged by a group that I'm in, Life on Fire, to do something for my 53rd birthday. Now, I've been thinking about how to make my nonprofit sustainable because I don't want to have to always ask for money to do things that I believe are game changing for sickle cell patients, right? But it costs money. So I decided I am going to write my third bestseller. Yes, it will be a bestseller. And it will be, I am hoping to clinch that number one spot for a third time for a November 12th release. I love writing. I love sharing, just empowering people. And so this is going to be a book of empowering patients, but educating providers. So I'm hoping that I will make that deadline. I already put it out there. So, and I keep putting it out there because it makes me stay up at night and meet that deadline. I love people. I am blessed to have an amazing village around me. And I don't take that for granted. I've been married for 26 years to everyone knows I call him my Superman. And he has been the best thing that has happened to me in my adulthood. And we're just a team. And so I'm very grateful for that. That's why I say I'm living my post-Job years. I feel very blessed to be in the space that I am in, to learn how to balance life, to learn how to be a good friend, how to be a good wife, how to be a good sister, a good daughter. And that's why I don't call them my patients. We just had a meeting yesterday because I kept wanting to drum in. I want them to be called sickle cell clients because I want to give them back some of the dignity that people stole from them. So we call them our clients. So we don't say sickle cell patients because they are not always a patient. There are so many other aspects to our lives. And I want to remember that and celebrate that.
That's a beautiful thought. I also noticed that you have traveled a lot. What are your most memorable trips? Tell us a little bit about that.
It's always going to be Nigeria. I'm from Guyana, South America, but I love Nigeria. And I did my ancestry or the DNA analysis, and I found out that I'm 35% Nigerian. And I was like, this totally explains it. I'm 98% West African, and 35% of that 98% was Nigerian. Now, my husband is Nigerian, right? And so I've always been jealous of him. One of the brightest people I know. And he's so humble about it. And I love just sharing his growing up, his life and everything. So whenever we go there, I feel like I just absorb so much culture, and people have such deep respect for their elders and for family and for education. Some of the brightest people. I came across an article that said that when it came to immigrants, that Nigerians represented the highest population of immigrants that had graduate and postgraduate degrees, right?
I've read the same thing. Yes.
Yeah. And so I'm very proud of my 35% Nigerian, and I love going there. I love being able to give back there. So even connecting with some of the nonprofits over there, it's amazing. Sickle cell over there is not like sickle cell over here. People truly suffer on a whole other level. And in many countries, I connect with people in Zambia, and it's the same thing outside of the United States, right? So just understanding that the world is not the same for these people and trying to lend a hand wherever I can ends up taking me in different places.
I'd
Yeah.
love to hear a little bit more about that, though. Tell us a little bit more about what you learned about the difference or the more impactful suffering that happens outside of the US or specifically in Nigeria. What insights do
Sure.
you have there?
I will never look at $7 the same way again. $7 can buy a unit of blood. And I didn't know that until someone asked me to buy them a unit of blood for $7. I could blow $7 Starbucks, a coffee and a scone,
Wow.
$7. But
Right.
$7 brings life. $7 brings life. The same thing in Zambia. It started with me mentoring a third-year medical student with sickle cell disease. And you've seen her actually on Facebook. I won't mention her name, but she's everywhere. She's like, "You're my big sister." So she was wanting to leave medical school because of her sickle cell. And so she saw me on Facebook and she's like, "Really? There's really a doctor with sickle cell disease?" And so we connected and I said, "Well, you're going to have to be creative about this, but don't leave. You've come too far." And she made it. She's done with her residency now. But again, same thing. So if you don't have insurance, you have to have the money right up front when you're sick. And if you don't have it, they will look at you and say, "What do you think I am, a charity organization? We need the money to run our hospitals." And it makes sense, right? They can't keep taking people without money. Otherwise, the hospital would go under. But these people don't have the money. And I think of how we are here and that at least there is a safety net of sorts where we can have even Medicaid to be able to see a doctor. And they don't have that. So when they can't go to the doctor, they have that surgery without anesthesia and they die a lot.
It's terrible. We're, of course, very in tune to the suffering that happens in the United States, but sometimes that's a very myopic view of what sickle cell disease truly is across the globe. But I
Sure.
want to hear one thing from you. As you are looking at the sickle cell landscape right now and how things are and where we are at this moment in time, what is your hope? What is your dream for what sickle cell disease looks like 10 years from now?
Oh, wow. I think we're in exciting times, to be honest with you. I'm hoping that we don't spoil it for ourselves. But I think that we're in exciting times where there are treatments that are coming out and we are waiting for those treatments. And we're so happy to hear that people haven't forgotten us, that they are compassionate to our journey and that they want to do something about it. We are grateful. We are grateful when we hear about things like that. And I know that it takes a lot. I know there's a lot of behind the scenes in phase 2, phase 3, getting to market, all that stuff. Just please don't give up. And we're waiting on the other side to receive it. But when it comes to what sickle cell looks like in 10 years, I'm hoping that we have options, so many options, because sickle cell is so individualized. Think about leukemia. You don't treat all of leukemia with one medication. Why would you think you can treat all of the hemoglobin, like all of the genotypes of sickle cell disease with one drug? So options is so key, and being able to have a treatment that may not work for one person, but will work for the next. And we have a chance to figure out which one can work for us and live our big, beautiful lives. I hope that we can get to a point where, providers understand that there's cultural sensitivity that needs to happen with sickle cell management. And we can limit or minimize or remove. I know that's probably asking for a little much, but not have to go to the emergency rooms because we're managed so well outside of them. And that we can look over to our shoulder to somebody who doesn't have sickle cell disease and not feel any different.
It's a beautiful thought. Thank you for sharing that with us. For individuals who are on this call, who listen to this, who want to support you, tell them how they can follow you, how they can keep up with what's happening in your life and in your organization.
Our organization is called Sickle Cell Medical Advocacy. And you can find us easily at sicklecellmedicaladvocacy.org, www.sicklecellmedicaladvocacy.org. And we certainly welcome your support, whether in time, because we need doctors too that are willing to help. Last year, we trained 4 doctors and 4 nurses as part of the class. We trained about 43 people over the course of the year to advocate for sickle cell patients in the community and knowing the NIH guidelines and everything that they need. But sometimes you don't have the time to do that. And so we certainly welcome your financial support. Like I said, I'm going to find a way to make us sustainable. I am looking forward to donating everything to the nonprofit because we need it. But until then, we have so much work to do, and we have everything from tablet devices that we need to the call center, that software that we have to pay for, where patients call in for help from all over the country. So I welcome any support that people can give, and thank you for asking. And of course, you can support me by my books. They're both on Amazon. Of course, I think Jeff Bezos has more money. He doesn't need any. He's going out into space with it and all. So if you really want a book, you can reach out to me at Simone Uwan MD at Gmail. And that's my I have a nonprofit email, but that's my individual email, and ask for a book, and I'd be happy to autograph it and send it to you for the same price that I have on Amazon. You can't go wrong with it.
That's quite the deal. You're definitely going to have an email from me asking for an autographed copy.
Thank you.
Dr. Uwan, I just wanted to take the moment, just express gratitude. Your time here with us today was more meaningful than I can express. We are working very hard to try to be impactful in sickle cell disease, and hearing stories like this, being encouraged by individuals like yourself, is extremely valuable and extremely meaningful. I look forward to seeing how your advocacy continues to reshape the conversation, and just know that you have a group of fans and supporters here at Agios.
Thank you. I appreciate that. That means a lot to me. So thank you. Thank you so much.
Of course. Well, with that, Agioi, you guys know how to find Dr. Uwan now. Please follow her on social media, check out her YouTube page, and be sure to email her for your autographed book copies. With that, happy Sickle Cell Awareness Month, and keep spreading the awareness.
Yes, thank you. Thank you so much.